Guide to warfarin. Warfarin. It's an anticoagulant, so it stops the development of clots. Don't call it a blood thinner because in actual fact it doesn't do anything to the thickness or thinness of blood. It's used in situations where there either is a clot, such as deep vein thrombosis, or when there's a very high risk of developing a clot, such as atrial fibrillation. And it works by stopping the production of clotting factors in the liver. The dose is different in different people and is affected by many factors, such as other drugs, the patient's conditions, and even things such as food. And so we measure its effect by measuring the INR, which stands for the International Normalized Ratio. We aim generally for a target of 2 to 3, where the higher values are associated with more bleeding. So if you're on warfarin, you definitely need to be able to have your INR measured. So warfarin works by inhibiting the effects of vitamin K. And vitamin K is involved in the production of clotting factors 2, 7, 9, and 10. Because it stops the production of these clotting factors, you actually need to wait for the clotting factors to decline in blood for it to start to work. So its effect actually takes some days to come on. Vitamin K is also involved in some anticoagulant effects. So when you stop vitamin K working, actually at first you tend to cause a bit of a procoagulant effect. And many factors then involved in the effect of the warfarin. So there's the level of the warfarin, how it's metabolized, the level of vitamin K, the dietary intake of vitamin K. And that's why the effect of warfarin is so variable and it's influenced by so many things, such as diet, change in physiology due to illness, and virtually all medications, because they either affect warfarin or they change the patient's physiology. So you need to measure the INR daily when starting warfarin therapy. Then you gradually reduce it to at least once a month. And once again, if the patient can't have an INR measured, they shouldn't be on warfarin. And once again, you need to measure the INR if a patient gets started on or stops a medication or if there's any change in their health.